Ladies and gentlemen, please welcome to the stage Advisor to the United Nations Secretary General's Envoy for Financing the Health Millennium Development Goals and for Malaria, and Interim Coordinator for the Nigeria Private Sector Health Alliance, Mr. Uzodinma Iwala.
So, good afternoon, everybody, and welcome. I have the pleasure of introducing two people that you know very well to talk today about the Nigeria Private Sector Health Alliance. So, I have with me the Honorable Minister of State for Health, Dr. Muhammad Ali Pate, and also the Group MD of Access Bank and CEO of Access Bank, and also GBC co-chair, Mr. Aig-Imoukheude. So we're going to talk about the Nigeria Private Sector Health Alliance and just have a conversation to tell you what the organization is about. The Alliance is a body of leading private sector business people who have coordinated with government to help support the Nigerian Ministry of Health in its Saving 1 Million Lives plan to meet the Millennium Development Goals. So with that said, I'm just going to ask the Honorable Minister to start off by telling us a little bit about the history behind the Nigeria Private Sector Health Alliance.
Well, thank you. I think those who have observed the Nigerian health sector know that we have a mixed health system. At the primary healthcare level, 2/3 of our primary healthcare centers are owned by the public sector, and at the secondary facilities level, 2/3 are actually privately owned. At the same time, we have issues with health outcomes. And for some time, we've been looking at how we engage with the private sector, both at the operator level, but also more broadly, to partner with the private sector in moving forward with the health agenda. The Saving 1 Million Lives initiative actually is one of those platforms for us to mobilize, to create a movement around improving health outcomes in Nigeria. And there's a saying that I'm sure many of you are aware of: if you want to go fast, you go alone, but if you want to go far, you go with others. So the Saving 1 Million Lives initiative was constructed as a partnership between public and private sector, civil society, traditional leaders, religious leaders, but importantly, our private sector corporate leaders who each have complementary partnerships that they can bring to the table that will help us move the health of our people forward. Maternal and child health, HIV, preventing mother-child transmission, malaria, immunization, nutrition, these are all areas that are very important to improve the health outcomes of Nigerians. And the private sector has been a very useful partner even before we came with the Saving 1 Million Lives, but now going forward, it's an important partner for us to move forward. So, leadership of Aig, Alhaji Aliko Dangote, Jim Obi, and other important corporate leaders in Nigeria has been very useful in this movement that we've started.
So Mr. Aig-Imoukheude, I just wanted to ask you about the private sector's involvement and how you came to the table to work with the minister for the NPSHA.
Thank you, Uzo. I think in Africa generally, we are seeing a trend where corporates, entrepreneurs, and if you like, high net worth individuals are playing the philanthropic role or meeting the philanthropic expectations of the larger society, taking them much more seriously. And you have found, let me say, over the past 5 years or so, on the individual level, 1, 2, 3, 4, even more African private sector leaders playing more prominent roles in the health space. As a result of this process, around about 2010, I think it was, the idea of organizing the Nigerian private sector in some form was mooted, and a business support group, was formed. And this has, if you like, evolved into a much more structured engagement through what we call the Nigerian Private Sector Health Initiative. Now, for myself, and if you like, Access Bank, our involvement in the health space, I think, goes back now some 8 or 9 years. We are one of the early corporates, in Nigeria, and non-multinationals for that matter, to get involved in one way or the other in mobilizing ourselves and the resources around us, towards health issues. And the whole idea in Nigeria seems to be, from the private sector point of view, that we are seeing very serious progress being made by our government. And in this regard, Minister Pate's initiatives resound very, very strongly with the private sector. The private sector likes to be, associated with success and with excellence, and he's doing, and indeed the government is doing some pretty interesting things. And the 1 million lives, and which links very strongly to the 3 Millennium Development Goals on health, is it's extremely creative, extremely impactful, and has mobilized the entirety of the nation around it. So on the back of that, we came together, some of the names that the minister mentioned, Aliko Dangote, who is one of the richest men in the world, Jimovia, a banker and also a telecoms entrepreneur, myself, and a few others, as well as corporations such as Stanbic. And we said, let's make this engagement between the private sector, the public sector, and of course even the civil society much more structured, and let's do it in an enduring and sustainable fashion. And so we brainstormed a bit and decided to put together a strategy. We worked with McKinsey on that, and we tried to get them to do it for free. They reduced their rates, but we were not that successful. But I think a few others, have contributed pro bono. And what we now have is we have an organization in place. We have a very defined strategy. We're about to complete our registration process, and very exciting things are beginning to take place. I get calls and I get interesting visits from particularly the multinationals who, some in the health space, some not in the health space, who find this initiative, the Nigerian Private Sector Health Alliance, very, very, very refreshing, and see it as a means of engaging.
So with that, I thought I would just ask both of you about some of the things that the Private Sector Health Alliance will focus on, and the ways that government and the private sector plan to work together on some of these issues, or these areas. I know, Honorable Minister, that you speak a lot about nutrition as an area that the private sector can have a great impact in Nigeria.
Yes, I think if you look at health space, for a very long time, nutrition has been relatively an orphan. It affects the health of our populations, yet it doesn't fit squarely within the remit of the Ministry of Health or Ministry of Agriculture. Part of it is in the private sector, part of it is with the regulator. And it contributes tremendously to the health challenges that we have among our children, among women, but also it contributes to, it's a detracting, malnutrition is a detractor of the human capital pool that we have. The cognitive deficit accruing to our economy because of malnutrition is significant. So to deal with it has an advantage for overall economic development, but the private sector also has an interest in ensuring that we have a healthy, capable workforce that will be employers, consumers in the future. So as part of the Private Sector Alliance and the rigorous process that was followed, the various aspects of saving 1 million lives tend to be covered. Maternal and child health, there are many champions. Government is investing almost $500 million of its own money. Immunization, we've got Gates, we've got other partners complementing what government is doing. PMTCT, we've got lots of partners from around, even within this room, as well as bilaterals. But nutrition was one that was really relatively less attended. And I think that is what informed the private sector leaders sort of really thinking that that's an area where they can play. Alhaji Aliko is playing in the food industry. There are many players in the beverage industry. I'm sure the banks and others have something to contribute, both in terms of advocacy, using their networks, but perhaps later also in terms of investments that they could do. So that's really how nutrition evolved as a key aspect, one of those areas where in the medium term we hope the Private Sector Alliance will complement what government is trying to do in the Agriculture Ministry, as well as with saving 1 million lives in the health sector, to see that we move our economy going forward.
You mentioned investment, and I wanted to ask Mr. Aig-Imoukheude a little bit about investing in the health space and how the private sector thinks it can work with the government.
I will preface my comments with this. The first thing, of course, is that a healthy population is more likely to lead to a healthy economy. I mean, a sick population tends to, imply a sick economy. The second is that a healthy workforce obviously also makes for a healthy company. And the last thing is that in Nigeria, 60%, if you like, of health delivery actually is private sector led. And therefore, if you think about the demographics, this is a huge industry in itself. So there are several reasons why it makes sense for the private sector to take an interest in what is happening in the health space as far as their countries and their economies are concerned. Now, obviously for non-health sector based players, the first reason why you would get involved would be, if you like, altruistic. I mean, some non-profit focused motivation. Now, however, as we get into understanding health systems and, if you like, mapping the entirety of health value chains, I find, and I have concluded that we were extremely ignorant. And I don't just speak for Nigerian corporates or African corporates. I think generally across the globe, the private sector is not as aware as it should be of how great, if you like, the business opportunities are in the various health value chains. There are logistic issues, there are supply chain, supply and value chain issues, and then even just simply the whole idea of if you have a health solution, obviously you have a ready market. I mean, who wants to be sick? And so if you look at investing in the health space, and if I'm looking at it like a finance person, it's almost like a blue ocean opportunity. You can pick and choose literally, where you want to play, and if you do it sensibly, it will be profitable. And, I guess there is no reason why we shouldn't speak of profit in health, and so from the Nigerian Private Sector Health Alliance perspective, one of the things that we set out to do is to create a marketplace, if you like, for networking, for education, and for mapping, if you like, what is happening in the Nigerian health environment. Indeed, actually, we had a discussion. Maybe we could pick a few commodity value chains linked to, of course, specific diseases or specific health challenges, and literally map the entirety of the Nigerian health space as far as those issues are concerned. Who are the players? What are the issues? What are the geographies? What are the regulations around them and so on? And therefore, any player who wants to get involved in this space literally goes to this website and it tells you everything you want to know. And once we have it and we've created it, we can measure how effective those value chains are or those systems are against best practices, and have a structured and systemic way of tackling them. Those are some of the things that we want to do. Innovative financing is also something that we've been talking about. And at the very, I won't use the term base level, but something that is coming out now is if you have a hospital, and this is public sector funded or private sector funded in Nigeria, and you want to invest in health infrastructure and equipment, whatever it is, it's almost impossible to get financing for it, okay? And this is the issue of ignorance that I've been talking about. But the reality is that because obviously these items of equipment are in scarce supply, the demand is incredible. So whenever you put one of these machines somewhere, literally they pay for themselves in a very short space of time. But for now, the hospitals, whether public funded or private funded, use all types of interesting ways of coming about this equipment, but definitely not efficient. So one of the things we're going to do is put in place an equipment financing scheme targeted at infrastructure for the health space. This is something that Access Bank is driving, but we are sure, banks in Africa are very, very competitive. So, we're sure that it's something that others are going to quickly jump on. Today, I would imagine that financing in that segment would be in the magnitude on an annual basis of total loans of, certainly it doesn't register as a percentage of total loans in banking. But I can actually envisage a situation where lending to the health sector can move from maybe less than 1 basis point of a percent to 2, 3, 4, 5%, and this is quite a large area. So these type of catalytic effects, can be achieved, through the type of thing that the Nigerian Private Sector Health Alliance is doing.
Will do. Right, and Honorable Minister, I wanted to ask you then also to talk about commodities and the commodities necessary for the Saving 1 Million Lives plan and how the private sector can work with government, both on a regulatory aspect and also from the investment side.
Well, in this audience, I know there are several members of the UN Commission on Life-Saving Commodities for Women and Children. I know Gary Cohen, I know several of the members of the audience were in that commission, where our president was co-chair of that commission together with the Prime Minister of Norway. And if you look at the recommendations of that commission, where there are underutilized, underfunded, but essential life-saving commodities which had not been provided or produced or manufactured or distributed to save the lives of many women and children all over the world, it will take not only governments but also the private sector participating in that. The global market shaping recommendations are there, but there are also local market shaping recommendations. So when we take zinc and ORS for diarrheal diseases in Nigeria, for instance, by just working locally and helping really identify the demand for it and signaling to the private sector, we've had a private entity, a pharmaceutical company, manufacture flavored ORS, oral rehydration solution, for diarrheal diseases, zinc and oral rehydration solution. That's just giving you one example of the potential role that a private entity can play in terms of making those commodities available. So from the manufacturing side, from the distribution and logistics side, I think you can see the complementary role that the private sector can make to what government is trying to do. From our side, the regulator is trying to ensure, in fact, that the regulatory processes are more efficient, stronger. Similarly, you can take micronutrients. They are not part of the commodities in the UN Commission that the UN Commission considered, but they are underutilized. But they are also potentially life-saving. They also add value in terms of the cognitive ability of our children long-term. So we can apply similar recommendations to shape the local markets, to signal to the private sector, to make available those powders or the fortified foods, be it iodized salts, flours, or whatever it is that people can then buy and improve the nutritional ability of our population. So you can look at it from family planning, distribution of those, the drugs. So then, like Aig mentioned, mapping the value chain will enable private sector play what it is positioned to play, and government playing its role in terms of regulation, policy, and financing. But at the end of it all, there's a public mission. The public mission, from our perspective, has to be really maintained. It's not really bad to make profit. In fact, it's good. For us to interact with Aig, he has to have a viable business, and it has to be profitable. But at the end of it all, there's also a public mission to ensure that we reach those people at the bottom of the pyramid who need to have access to zinc and ORS, who need to have the antibiotics for pneumonia, who needs to have the vaccines, and for those women to have the life-saving commodities in the rural facilities. So as we interact, the public mission is key, but we can address the public mission working with the private sector in a win-win collaboration, and that's what we're trying to do.
So I wanted to ask both of you what you have learned so far in your interactions from the private sector side and from the government side, learning how government works and learning how the private sector works, and what lessons you've taken from that.
Honorable Minister, do I go first?
Yes, I think you should.
Thank you. I think the first is universally true, which is that the private sector is more efficient for many reasons. And I'm not saying just for Nigeria. I think this goes across the globe. And therefore, as much as possible, if we can get more of an interaction between government and the private sector, I find that it raises the level of efficiency of government. At the same time, I find that the private sector can be very short-term in terms of its understanding and appreciation of the public mission. And we can never get our minds, or we should never, get our minds away from the fact that there is a goal, and which is to eradicate disease, and which is to achieve, if you like, the 3 MDG health-related goals. So, whilst, yes, we would like to pick and choose which sectors, which segments, and which commodities, and prescribe, how, things should be done, one way or the other, we need to marry, the public good and address things from a more holistic perspective. One thing that I have certainly learned is that it looks like the public sector is more in tune with the other leg of the stool, which is the civil society and that general community, than the private sector. And these groups, these stakeholders are critical, fundamentally critical, to healthcare delivery, particularly, in countries in sub-Saharan Africa. And therefore, I mean, of course, the private sector tends to have this nervousness around civil society. This is more from the, are they coming to my annual general meeting kind of concern, But the private sector has to understand much better the role and the relevance, if you like, of civil society. And that's one of my strong learning points.
Honorable Minister.
Yes, I think there are many learnings, one of which I think is the realization that the private sector leadership actually also cares as much about the health outcomes and the health and well-being of our people. When Alhaji Aliko went to Kano, for instance, he went to primary health care center, the feedback, you could see how touched he was and how willing and very keen he was to see that the improvements were being made. When Aig talks about malaria, or Jim Obia is talking about diarrheal diseases, there's a lot of passion within the leadership that we're working with in the private sector, which I did not, I knew they were good people, they were good leaders, but I really was impressed with the dedication, the time and commitment that they've put in that. So from the public perspective, it's not only the government that is really trying to drive this, I also see complementary hands from the private sector. But the second aspect is the flexibility, adaptability that I think we've seen in the partnership with the private sector. We've moved in some ways very quickly, working with the private sector leaders. Government by its nature tends to be more deliberative in terms of what it does. So the innovations that we've tried to create in the health sector, the saving 1 million lives, we've worked with many private entities, and we've found them very nimble and willing to innovate, to take risks that ordinarily from government it will be a little bit more difficult to take those risks. Certain investments were made. Other global private sector entities like Children's Investment Fund were willing to provide technical assistance, or even I think Apex Partners, John McGrew was here yesterday, to take some risks and undertake things that ordinarily government might not be able to do quickly. And I think that's something that was very positive that I've also learned.
And both of you have mentioned partnerships quite a bit, and so I just wanted to ask you how you see the Private Sector Health Alliance working with partners on the ground.
The issue of partnerships is fundamental, I think, to addressing health challenges. If you look at, for example, at malaria, and I look at this as a, if I look at this from a business perspective, I look at malaria, and at the end of the day, really, it's not that difficult. It's a simple disease to prevent. It's a simple disease to cure. It's a simple disease to deal with. And yet, in the time we've spent here in Nigeria, you can count how many people have died. So why are we finding it so challenging to deal with malaria when we can move from 400,000 phones in Nigeria to 100 million phones in 8 years? So, and I then, the more I've gotten into it, the more I realize that the demographic realities, the cultural realities, the sheer numbers we're dealing with, and other issues, and then of course the poverty factor, makes it impossible for one person to try and solve the problem, even if you had all the money in the world. So partnerships are a necessary approach to dealing with this. Now, in the Nigerian Private Sector Health Alliance, partnerships work at various levels. Obviously, you have company to company, which through networking and learning and so on, you develop. Probably also most fundamental, government to private sector. And I see the private sector to civil society to government, tripod. We also have internal and external partnerships. So you have Nigeria and the rest, if you like, of the world. You have partnerships with multilaterals. And so if however you slice and dice it, you begin to see why partnerships are important. And that goes to the issue of why the Health Alliance in itself is fundamental, because I use this analogy, but don't take it too seriously. But sometimes you can find all these stakeholders in a country trying to do good, but end up running around like headless chickens, and bumping into each other, quarreling, and we all have the same good and the common goal in mind. And what the Health Alliance will try to do is to make these partnerships work. Create a structure, literally an enabling marketplace for partnerships to thrive.
When we launched the Saving 1 Million Lives initiative, I think we had more than 20 different private sector partners of different kinds, globally, but also nationally, who somehow participated or contributed. The diversity of the partnership, I think every member of the partnership has something to offer. The trick is finding what is that value that they bring to the table and orchestrating it such that they fit with the whole that you're trying to create. Because if there's lots of duplication, that's not efficient. But understanding what is it distinctly different of value that a partner brings to the table and organizing it in such a way that the whole helps us to move forward in the direction that we want to go. So in partnership, in my own understanding, and from the experience that we've had in Nigeria, there's a lot of diversity, but each partner has something of value to offer. So it's identifying what is that of value and how do you harness it. And that's the role that government, I think, is uniquely positioned to convene in a country like ours, so that partners are not running around bumping into each other and being very inefficient.
So I think with that, we have only about 2 minutes left, but if there are any questions or if there's anyone who wants to comment, we can take that now. But otherwise, thank you very much for listening. Just to a little bit of a summary about the Nigerian Private Sector Health Alliance, and I'm sure we'll be around to answer questions after as well.
Cool. Thank you.
Thank you.